Hey everyone, this is Master Dan. So we're gonna talk tonight about inflammatory bowel disease. So everybody, when you listen on this topic, be careful because it's very tricky and very complicated. And what I've heard, this is one of the topic of the upcoming TOS, the table of specification. Alright, so let's start. So when we say inflammatory bowel disease, there is what? Inflammation of our bowel. What is bowel? The large intestine. So what are the causes why our large intestine inflamed or why our bowel is inflamed? Just remember there are three main causes. Number one, unknown. Number two, autoimmunity. When we say autoimmunity is one of the common cause. Why? With autoimmunity, there is increased function of our immune system. It will produce a lot of antibodies. However, there is no antigen or foreign bodies. So these antibodies will attack our self, which part? The colon. So when our antibodies attack the colon will be inflamed. That is why there is inflammatory bowel disease. And another cause, that is hereditary. So when we say inflammatory bowel disease, there are two. So follow me. The first one is Crohn's disease, also known as your regional enteritis. And the other one, we call that ulcerative colitis. Crohn's disease, ulcerative colitis. So let's differentiate the two. How to memorize, how to understand it easily. First, when we say site, when we say Crohn's disease, the starting point is your ileum to ascending colon. Okay? So here, it will start in the ileum going to the ascending colon. Don't forget the location, ileum to ascending colon. When we say ulcerative colitis, it started to the descending colon and then going to the rectum, going down to the rectum. So, ileum to ascending colon, Crohn's disease. Descending colon to the rectum, that is your ulcerative colitis. Why is that very important? Because sometimes it will be asked, where is the location of the pain? So if you look at in front, we all know that the ascending colon is located on the right side of our abdomen. So when we say location of pain, for Crohn's disease, the location of pain is at the right lower quadrant. Since ulcerative colitis will be located in the descending to rectum and descending colon is on our left side, that is your clue that the pain for ulcerative colitis will be felt at left lower quadrant. One of the main difference, both of them have inflammation, right? Both of them have inflammation. One of the difference is that the type of inflammation. So when we say Crohn's disease, the type of inflammation ay patches. What do you mean by patches? Look at the picture in front. If this is Crohn's disease, one area, there's inflammation. In this area, there's inflammation. In this area, there's inflammation. So if you can see, the inflammation patches. It's not continuous, it's overlapping, there's patches. So when the doctor assesses this using colonoscopy, the doctor will see patches of inflammation and the doctor can diagnose that this is Crohn's disease. However, the difference with ulcerative colitis, the type of inflammation, we call that continuous. What do you mean by continuous? The entire colon ay affected. Example, for ulcerative colitis, there's inflammation here. The entire colon is affected. So that is why the inflammation is continuous. Next, the layers. We have different layers, the inner layer, the middle layer, and the outer layer. So the inner layer, that is your mucosal, that middle is the submucosal. So there's a lot of layer. When we say Crohn's disease, the affected layer, we call that transmural. What do you mean by transmural? All the layers are affected, included the mucosa, the submucosa, and the outer layer. However, when we say ulcerative colitis, the only layer that is affected is the inner layer. That's it. So, when we say Crohn's disease, this is where you call the cobblestone appearances because all the layers are destroyed here. Diarrhea. Since the function of your large intestine is to absorb water, again, the function of the large intestine is to absorb water. And since there is inflammation in both of these, there is a dysfunction in the absorption of water. There's a problem in the absorption of water. That is why one of the prominent signs here is diarrhea. However, which of the two has more damage the Crohn's disease or ulcerative colitis. If you see the diagram in front of you, ulcerative colitis has continuous inflammation. In short, there's a lot of area, large area of the colon that doesn't absorb water. That is why the diarrhea in ulcerative colitis is severe. Compared to your Crohn's disease, these are only patches. So some portion of the colon can still absorb water. That is why their diarrhea is only mild. However, because of the word ulcerative, there's a word ulcer, there's a wound. That is why ulcerative colitis has severe bleeding, while Crohn's disease has mild bleeding. And then, here comes fistula. When we say fistula, there is another route. There is alternate route. So when we say fistula, for Crohn's disease, fistula is common. So we can commonly see fistula. When we say fistula, there's another route. Example here. There's a route. There's a fistula. There's another road going out from the colon. But when we say ulcerative colitis, the fistula occurrence is rare. And then, the rectal involvement. There's little chance that from the Crohn's disease, ileum ascending, that it reaches the rectum. Only 20% chance that it reaches the rectum. However, for ulcerative colitis, there's 100% chance that it will really reach the rectum. Go. Let's continue. Okay, let's a little review. Crohn's disease, ulcerative colitis. Let's start. Side, ileum to ascending colon. Here, descending colon to your rectum. Next, pain. Where's the pain? Here, right lower quadrant. Here, left lower quadrant. Inflammation, Crohn's disease. Patches, inflammations for ulcerative colitis continues. Next, layers affected. Crohn's disease, all layers. We call that transmural. Here comes ulcerative colitis, the inner layer, the mucosal layer. Next, diarrhea. Severe, mild sa Crohn's disease, severe for ulcerative colitis. Bleeding, mild, severe. Fistula, common, rare. Rectal involvement, only 20%, and this one is 100% that will really involve the rectum. Let's go with the confirmatory test. When we say how to confirm either it's ulcerative colitis or Crohn's disease, don't forget the only answer there is what? Biopsy through colonoscopy. Biopsy through colonoscopy. Using this test, the doctor can determine or differentiate if it is ulcerative colitis or Crohn's disease. Now, since we all know that IBD, I stands for inflammatory bowel disease, we need to give anti-inflams. The first anti-inflam, we call that the aminosalicylates. These are anti-inflammatory to relieve the inflammation. Second, we can also give corticosteroids and immunosuppressants for two functions. Number one, it can relieve inflammation. Number two, since the cause is autoimmune, it can treat autoimmunity. And number three, we need to give antibiotics for bacterial infection. So dalawa po. First, ciprofloxacin, and second, the metronidazole. These are all broad spectrum. Next, for nursing consideration, if they're gonna ask, what should we do? Just remember, let the bowel rest. Do not give something that increases the bowel movement. Example, what is the best diet? NPO or high fiber? Never forget, let the bowel rest. Bawal po ang high fiber. It should be NPO. Since the patient is in NPO, NGT or TPN? NGT or TPN? The answer is NGT. TPN. Never give the NGT because you need the bowel to rest. So the best answer is TPN. Next, do we need to give laxative or anti-diarrhea? The answer is anti-diarrhea because we need to let the bowel rest. Ayan. So thank you so much for listening about inflammatory bowel disease. If you have any question and if you still want the full videos of my discussion, you can check my YouTube channel. Just follow me or subscribe at MasterDan23 in my YouTube channel. Thank you so much and see you in my next discussion. In my next discussion, I'm going to discuss all about TOS, this coming November 2025 board exam. Thank you so much. Bye everyone.